My name is Kelly, and today I would like to talk to you about a potential cancer research project that may affect your practice. I would like to speak to you today about middle school cancer prevention. Population-based cancer research can provide information that may improve public health. In the United States, cancer prevention is a public health focus. Today's youth have the potential to have lower cancer incidence than any other previous generation. Intervention strategies in youth offer an opportunity to develop healthy lifestyle behaviors that may impact their lifetime risk of cancer. My question is, does providing education to 6th grade students regarding the importance of healthy lifestyle habits increase their awareness about how to prevent lifetime risk of cancer? My organization is accredited through the Commission on Cancer through the American College of Surgeons. The COC has set forth standards to ensure high quality, multidisciplinary, and comprehensive care is being delivered to patients. They focus on collecting data to measure the quality of care, and they also focus on development of effective educational goal programs to achieve their goals. The COC requires that each cancer program form a cancer committee, which is a collaborative team that focuses on setting goals, planning, implementing, and evaluating all cancer-related activities in the program. I am the Community Outreach Coordinator for my organization's Cancer Committee. I am responsible for monitoring the effectiveness of prevention, screening, and outreach activities. This research question is of interest to me as I would like to investigate if educating students at an impressionable age increases their awareness about healthy lifestyle choices and in turn may decrease the risk of lifetime cancer. Disease prevention is based on the idea that some of these risk factors may be modifiable. Some modifiable risk factors that may be discussed with 6th grade students include the following: tobacco usage, poor diet, and physical inactivity. The purpose of this research idea would be to educate these students before they develop these risky behaviors. According to Santelli, Sumravikant, Edelstein, and Free, they identified that cancer risk behaviors are developed early in life. Smoking, physical inactivity, early sexual activity may all begin as early as age 12. 80% of adult smokers begin smoking before the age of 18, and typically none of them begin after the age of 25. Additionally, 58% of adolescents engage in sexual activity before the age of 18. Often these risky health behaviors continue into adulthood. A team of nurse navigators and educators would be developed to help participate in the programs. Some of the educational topics they would focus on when going to the classrooms would include general cancer information, healthy diet, exercise, tobacco risk, and sun safety. Each educational module would be a 30-minute interactive presentation that would be age appropriate. Parents would need to sign permission slips in order for their students to participate. The American Cancer Society has defined cancer as a group of many related diseases that all have to do with cells. Cancer occurs when cells that are not normal grow. Abnormal cells clump together to form tumors that may damage healthy tissues. It would be important to keep this definition simple when speaking to students of this age group. 1 in every 2.5 individuals are likely to have cancer in their lifetime. 75% of all cancers may be prevented through healthy lifestyle choices. This presentation should be impactful and interactive. At this point, in order to engage the students during the class, it would be helpful to ask for 10 students to come and stand before the rest of the class. Then the teacher would ask for 6 of them to sit down. The 4 remaining students would show the likelihood of that group that could have cancer. Then they would have 3 more sit down to show how many of those could have been prevented. Healthy diet and exercise are a way of helping to maintain a healthy weight, which helps to reduce the risk of cancer. Mahabir studied the association between diet during pre-adolescence and adolescence and discovered that maintaining a healthy weight reduces the risk of cancer. Being overweight increases cancer risk because it causes the body to produce more estrogen and insulin, which stimulate cancer growth. One way to incorporate the class to become engaged during this session would be to play an age-appropriate popular song and ask the students to learn a dance or participate in physical activity. Smoking is the leading cause of death in the United States. Dubey and his colleagues studied pro-tobacco influences and susceptibility to smoking cigarettes among middle and high school students and determined that it is important to make sure they know the various types of tobacco. Some different types of tobacco products include the following: cigarettes, chewing tobacco, electronic cigarettes, pipes, and secondhand smoke. We will now watch a short video.
Stacked up against other forms of tobacco.
We will now
For
proceed
example,
with the video.
what do you think is safer? Cigarettes or cigars?
Probably cigars, because there's like less additives and stuff, I guess.
How about cigarettes versus pipes?
I think smoking cigarettes is safer than smoking pipes.
Pipes and cigars really have the same danger as smoking traditional cigarettes because you're getting the nicotine, the tobacco, and all the toxins that you get from burning the tobacco, just like cigarettes. That occurs in cigars and pipes as well. Another way to smoke tobacco is with a device called a hookah.
The hookah is also known as a water pipe, and you use it to smoke a tobacco, which is burned with charcoal, and the smoke goes through water and people inhale it through a pipe.
I would probably say that smoking from a water pipe is safer.
A lot of people think it's kind of safe to use hookah. It comes in different flavors too. The smoke from hookah, though, science shows contains a lot of things that are similar to cigarettes. It does contain tar, and it does contain chemicals which are linked to cancer.
Okay, so we've heard that however you smoke tobacco, it's bad for you. But how about tobacco you don't burn, like chewing tobacco?
I think chewing tobacco is safer because from what I know from it, a lot of athletes, like baseball players, do chewing tobacco, so I would think that if an athlete can do it, it would be safer than smoking cigarettes.
Tobacco that you chew or snort or snuff, that all contains nicotine, which is still addictive. The chewing tobacco actually contains little pieces of broken glass to help get the nicotine into your system a little bit faster. So think about that before you put the chewing tobacco in your mouth.
I know chewing tobacco can lead to mouth cancer and other sicknesses.
Tobacco products like chewing tobacco, snuff, dip, which are all smokeless tobacco products, tend to have greater rates of oral issues. So cavities, gum disease, tooth decay leading to tooth loss.
And you can develop cancer in your mouth, head, and your neck in the future.
It's equally as dangerous because it's still going into your system, and it will also cause damage to yourself as well as just regularly smoking it.
Correct. Remember, if someone tells you only cigarettes are bad for you, don't believe it. They're just blowing smoke. For Teen Kids News, I'm Emily.
Medical emergencies happen. That's why knowing what to do is so important.
Thank you. Sorry about the delay. Some other sun safety tips related to this topic matter are to seek shade during sun times, cover up with hats and sunglasses, apply sunscreen with SPF of 30 or greater, and remember to reapply it every 2 hours and to avoid tanning beds. That mostly concludes what the educational topics would cover. We would then want to consider what our sample size would be. We would like to partner with middle schools in the community to educate youth on cancer and cancer prevention strategies. We would initially like to start with a sample size of 100 students. This would allow to test the program and make future changes. We would begin with groups of 20 to 25 students per class. Each session would be 30 minutes long, and we would use nurse navigators and educators to deliver the presentations over 1 week's time. We would want to be sure to monitor our effectiveness to show that it would be pertinent to your practice. We would begin by obtaining pre-test scores to identify baseline knowledge about cancer prevention. We would then obtain post-test scores at the end of the week to identify if the knowledge increased after the educational modules have been delivered. Keller and Kelvin define variables as being factors that may be changed, controlled, or measured. Some variables for this study would include the following: knowledge level of the presenter, teaching and learning styles, parental involvement in students' academic and social life, cultural status, socioeconomic status, and learning disabilities. Research is important to determine if intervention strategies during this time will impact behaviors and exposures that may reduce lifetime cancer risk. In conclusion, youth in the United States face 1 in 2.5 lifetime risk of developing cancer. Many of these cancers can be prevented through lifestyle changes and diet. Early adolescence is a unique time of susceptibility where high risk or healthy behaviors are developed. Moving forward with this research project will allow clinicians to focus on future opportunities related to cancer prevention activities for this age group. Thank you for your time.